ever wondered if your gut health could be the key to feeling calmer and more in control? Or why do some people struggle with brain fog, fatigue, or anxiety, even though they seem to be doing all the right things? Well, today we're going to be talking about the world of functional medicine with Dr. Tracy McCarthy. She is a board certified psychiatrist and expert in uncovering the hidden causes of mood and mental health struggles. She's helped thousands regain their vitality by addressing microbiome imbalances, nutrient deficiencies, and even toxic exposures or toxin exposures. So, if you've ever felt like traditional approaches to mental health were missing something, or if you're just curious about how food, inflammation, and lifestyle impact your mood, then this episode is for you. Let's welcome Dr. Tracy McCarthy. Thank you for being with us.
Thank you so much for having me.
Well, I am so excited about this because I am kind of on a health journey. I'm not totally, I don't always go completely organic or, like follow a certain diet, but I want to live to be 100. And so I'm
Mhm.
always thinking about how can those years that I have left be really healthy and my brain is functioning well and my body's functioning well. And so this is really important to me, but I love how you're working with how does food and health affect our mental health because people are not putting those two things together. So tell us a little bit about like how you got started and what you're doing in the world.
Yeah, I can definitely tell you how I got here because it was not where I thought I was going to go. I'm a conventionally trained medical doctor, and I went to medical school because I really wanted to understand, what goes wrong in the body, why do people get sick, and how can we help that? And the first part of medical school really was about that, and I enjoyed it a lot. And as my training progressed, it started to shift to being really just about identifying patterns of illness, which is very important, patterns of symptoms, and then labeling that with a diagnosis and then matching that to a pill. And it,
Mm,
in many ways, reduced to that. And that became frustrating because I was still asking, why? Why does this happen? Why does someone get, for example, might feel schizophrenia? And they'd be met with a shrug, we don't know, end of conversation. And that wasn't very satisfying to me. And as I was then practicing and prescribing medication, my patients and I ran into this frustration of this is sort of all we've got. There's not a lot of other tools. Yes, therapy is very, very important, but that's not going to fix everything.
mhm.
And the medications may have gotten someone a lot of symptom relief, but often it was only partially resolved. And then they're asking, am I going to be on this for the rest of my life? Often they're on many, many medications in the case of psychiatric illness. So it was limiting. And fortunately, around the time that I was becoming frustrated with this, I began to learn about the role of chronic inflammation in the body and how that affects everything. And
Mhm.
there's all this research on this. And I found this in the context of people talking about, for example, autoimmune disease and reducing their inflammation through diet and lifestyle, and then having such improvements in their symptoms. And I was shocked because I hadn't learned any of that in medical school. And
Mm.
actually, eventually I was kind of mad about it because I naively thought I was going to learn everything I needed to know, in medical school.
Mhm.
I mean, that's funny now to me, but
Mhm.
so I began to wonder about, first I started to implement these things in my own life just to see, hey, if I eat, in a way that balances my blood sugar and I eat more for reducing inflammation, how will I feel? And I felt better. I felt good. And, my family started making changes like that. And I really started to wonder, could I apply this in mental health? I mean, and now again, that makes me laugh. But at the time, I couldn't grasp it because everything is so separated in medicine. It's like these silos: gastroenterology for your gut, neurology for your brain, psychiatry for your mind, which is very
Mhm.
weird. Those are separate, right? And cardiology. And so to find out that I could actually, to find out that I could apply this and actually see results and symptoms was very, very exciting idea for me. And
Mhm.
therefore, fortunately, I was able to start to experiment with this. And I realized I would have to open a private practice to actually implement this with patients because I was working in a hospital, a psychiatric hospital, where I really couldn't influence what people were eating
Sure.
and the environment. So I did my training with the Institute for Functional Medicine once I found them and realized that's where I would get to learn these tools, began my practice, started to see really exciting changes in my patients, and they felt so empowered, like there was stuff they could do to feel better. And so I, kept trying new things that I'd learned, started work on their gut health, started to work on detoxification, hormone balance, all these things, and just saw better and better results. And it's brought me to where I am today, that I'm so grateful that I get to work with wonderful patients and partner with them to help them really heal themselves, and know that like there's so much more that's possible besides sort of the limited options that they're often given when they go see their primary care doctor or their psychiatrist. And I'm not trying to put down those options, because medications are important tools, and of course therapy is critical, but they're ignoring the body and the role of what's happening in the body, that the brain is part of that, obviously. So it's all connected, and that's always what I'm trying to help people see.
I love that you're doing that. I know my first time that I realized that these are like physical and mental health are so connected was I had a student when I was a school counselor for 25 years. And in the 90s, I had this student. She did not come to me willingly. Her friends forced her to come talk to me.
Wow.
And she was cutting into her legs and burning herself with an iron. And she was doing all these things. And they were like, she needs help. And still to this day, but much better. But then talking to a family about getting mental health help was very, scary, and there was a stigma to it. And so I would always talk to the family about, well, go to your general practitioner, go to your doctor first, and
Mhm.
just see if there's anything that they can help you with. And they also have referrals to other things just in case. And it was just sort of my standard thing that I said to people, just because they could hear, go to your pediatrician or go to your
Yeah.
doctor, they felt okay about that. When you would say go to therapist, they're like, oh my gosh. So I didn't say it because I thought it was a physical health problem. I just thought this is a way to get them into the mental health help that they need. And this girl never talked to me again, like for 3 years. She was so mad that I called her parents. But at the end of like the last day of school on her senior year, she came to me and she said, I want to thank you for calling my parents, because I actually had a thyroid disorder that was causing me to be depressed, which then I was doing these things to myself. And she said, once I took medication for that thyroid disorder, and I don't know what the disorder was, but she said I felt so much better. And then she went on to become a teacher and, went on with her life and did all the things. And that was my first time when I was like, wait a minute, these
Mm.
things are really related to each
Yeah.
other. And so it's just fascinating that, that was so long ago, and we're still confused about how these things are connected when
Yeah.
we see these things happen.
That's a great example of, how physical cause is contributing to mental health. And it is weird that we don't tend to think of them as connected still. I mean, and it's just a weird kind of cultural thing, I think, and from our medical model, it's a
Mm-hmm.
problem, because
Yes.
everything is connected to everything in the body.
Mm-hmm.
Our thoughts are influencing our physiology are influencing our thoughts. It's all
Mm-hmm.
connected.
Yes. Well, I'm glad that there's more people out there like making us realize this and showing us what to do. So, if someone feels like what are some of the things that people are eating or doing, or what's happening in their body that might be creating anxiety or
Mm-hmm.
panic,
Mm-hmm.
which is what most of my clients and listeners probably are listening for, is about the anxiety.
Yeah, this is such an important topic. I would tell you that I think the number one thing I see contributing to anxiety is blood sugar problems.
Mm,
It's a little different than, in a way, depression, which I would say is more related to inflammation, although blood sugar problems absolutely trigger inflammation. And this is, again, all interrelated. But lots and lots of people, and teens are definitely no exception to this, are eating usually a more higher carbohydrate diet. The standard American diet is super high in carbs and processed carbs. So think of chips and soda and, baked goods of any type. And they're often not eating enough good protein, and they're often not eating enough fats, especially healthy fats. And so what they're all doing is riding the blood sugar roller coaster. It's up and down all day. And what can happen there is when you eat something really carby without any protein to balance it out, without good fats, your blood sugar can really spike. And then it drops suddenly once the hormone insulin in the body, that's in charge of taking that blood out of the bloodstream and putting it into the cells. Once that gets going, the blood sugar drops very rapidly because, again, none of this is balanced out with fat and enough protein. And so that plummeting blood sugar, that's a horrible feeling. And it triggers the release of adrenaline. The
Mm,
adrenaline is there to rescue the blood sugar so it doesn't drop too low. So suddenly you're feeling adrenaline coursing through you. And that's very often that feeling of anxiety or even panic. And this
mm,
can be happening multiple times throughout the day. This can also happen in the night. Someone can wake up at like 1 a.m., super alert, maybe also feeling anxious, feeling sort of wired. And it's because their blood sugar dropped right before that.
mm,
So this is something most people are totally unaware of. And, in the case of the patients I work with, I'll have them wear a continuous glucose monitor for a couple of weeks, which is a really cool way to know what's happening with your blood sugar. It uses an app on your phone and you can see, is my blood sugar pretty stable? Does it rise a bit after I eat and then gently come back down, which would be normal? Or does it spike and then drop? And is it doing that all day? And people can really see that correlation. And I've had some really dramatic experiences with patients where when they reduce some of those carbs and they pay attention to protein and fat and they balance out that blood sugar, the anxiety evaporates. Now it's
mm.
not everybody's anxiety, but it's a
Right.
big contributor and it could be a big piece of someone's anxiety, even if it's not the only piece. So that would be the first thing I would say.
Okay. Well, and you have your patients wear this monitor. Is this something that anyone could go to their doctor and say, I want to do this? I want to check my or wear one of these things?
I mean, unfortunately, I would say no. Most doctors aren't using this. They're designed for people with diabetes. Lots and lots of, I would say biohackers are using these, but Dexcom just came out with one that no longer requires a prescription. So that's a game changer. Uh,
Okay.
the ones I've been using with my patients are all prescription. So the
Mhm.
fact that you can now get a monitor without a prescription means people can look at this themselves and see what's going
Mhm.
on, which is, I
Mhm.
think, important that they have access to this information because this is a thing that not only could help your anxiety, but would dramatically change your whole health to have stable
Mhm.
blood sugar. Because high blood
Yes.
sugar, causes high cholesterol, contributes to coronary artery disease, et cetera, et cetera, et cetera, like long list of conditions associated with that high blood sugar and insulin resistance, which is the root of
Mhm.
that.
Well, and I would think if you could watch that and see when it's going up and down, then you can make different decisions and you
Exactly.
understand your decisions and that I ate this and this happened. And especially I think for teens too, they would need to see that reaction of when I eat this, this is what happens. Because even
Yeah.
though they're feeling like this roller coaster in a way, they don't really realize that what is why that's happening. Like
Yeah.
I'm
Yeah.
feeling this way because of something I ate or drank or whatever.
I think most people aren't aware until they start to really go down that journey of trying to see if something is connected and they start to pay attention and start to tune into that. And that's a process I see my patients start to do. But I feel like it's not the standard way we're walking around in life. With a lot of people don't have that consciousness. And this is a wonderful tool for that. I have to say, every single patient who's used it, no matter kind of their personality and what they find interesting, they all think this is interesting. And I
Mm,
think it's because of what you said. It's like that direct personal data. They see what happens, and people don't react the same to the same foods. Like it's very interesting. It's very individual.
mhm.
And so, and they can even see when I'm stressed, that affects my blood sugar. Like there's just so much information in it. So
Mm.
it's pretty cool direct feedback.
Yes. Do those aura rings, and maybe you don't know anything about this because I know that, people are kind of talking about them, those rings that you
Mhm.
wear that give you different information. Does it track that kind of stuff or is it more
The
like
Oura
your
rings track
heart?
a lot of things, but it can't do blood sugar.
Okay.
But it can give you an indication of stress level through something called heart rate variability.
Oh, okay. So they could see some things, but maybe not.
Yeah, it would be a nice
Certainly not
adjunct.
that.
Sure.
Hmm.
Yeah.
Yeah, that's true. And then you mentioned inflammation, and I know I've been reading more about that in the last few years because they have also connected it to cancer. Pretty much anything bad that can happen to you is
Make it
connected to
chronic.
inflammation.
Yeah.
So, do you obviously you probably help your clients like figure out a diet that helps them to lower inflammation in their body?
Yeah. So, inflammation has a lot of causes. And let's just take for a second just to explain what inflammation is, because I'm thinking
Hmm.
maybe not everyone
Sure.
knows. It's your body's reaction to an injury or an infection that is a natural thing that should happen to try to heal that or fight off that infection. But when we're talking about chronic inflammation, that's a problem. That means there's different sort of irritants in the body, different triggers for that inflammation to be kind of ongoing and simmering and never resolving. You can kind of think of it as like a battle in the body. There's all this sort of collateral damage happening. And, instead of like it happening one big war and then you clean it up and you move on, it's like happening all the time. And that is damaging and a problem. And there's never time for the body to be in really more of a repair and rest mode when it's always dealing with these stressors. So one of the first steps for reducing inflammation is looking for what are we putting in our body that's just triggering inflammation? Because of course we can get it from things we don't know about, like toxic exposures, like living in a moldy building or going to a moldy school. That's way more common than people realize, unfortunately. Or from an infection in our gut. But food is a big thing. We're eating it all the time, right? Every day, multiple times a day, we're putting food in our body. And some foods are just inflammatory to everybody. So this example of that are these highly processed carbohydrates that I already mentioned that cause blood sugar spikes. Those are definitely inflammatory at baseline for everybody. There's also certain fats that are going to be inflammatory, something called omega-6 fats. So we actually do need omega-6 fats, just like we need omega-3 fats, which some people have heard about in like fish oil. Balance each other out. So omega-6 is like the accelerator on inflammation, and omega-3 is like the brakes on inflammation. And I always say in America, people are driving around with like pedal to the metal and no brakes at all because they're getting tons of omega-6 in their diet. That's in things like, corn oil and peanut oil and, and all these oils that things are fried in and that are cheap grain based oils, not things like avocado oil or coconut oil. Those are good. Olive oil. Those are great. But so these high omega-6 fats, we're getting tons of them. And then lots of people are getting no omega-3s. And so, again, that's just a pro-inflammatory state, we would say. It's just like putting lighter fluid on everything and throwing a match on it. So shifting out of, getting those processed carbs, getting the sugar reduced or out, getting those omega-6s really reduced and adding omega-3s, that will shift the sort of ratio of signals in the body for promoting inflammation and calming inflammation. And that's a huge change. And people can feel so different just from, several weeks of making that change. I mean, even within days, sometimes with the sugars. But it's a very great place to start because it shifts so many things in the body. And it shifts the bacteria in our gut. When we're feeding them better food, then the good bacteria grow more and the bad ones are getting starved. And so it's just has a lot of ripple effect that is very beneficial.
That sounds good. Now, those things like, just trying different ways to eat or, trying to cut out things that are bad for you. But what if the inflammation is being caused by things you don't know about? Is there some way to be tested to see what's causing inflammation in your body?
Yeah. So what the first thing is to look at testing to indicate, is there inflammation? And there's a lot of ways we can see that. It shows up differently for different folks, but there's a number of markers on blood panels that'll kind of create a pattern where you can see there's inflammation. In my patient population, like I do extensive testing. So this is the functional medicine approach, which is really looking at, hey, what are all the root causes contributing to the chronic symptoms? And notice I said causes because we are in the mindset usually of like, what's the single cause of this chronic illness? And it's never one thing with chronic stuff. It's always multiple pieces of the puzzle. So you have to get out of that mindset that there's just the one thing and get to, okay, what are the pieces of my puzzle? And so in my practice with patients, I'm doing a very comprehensive blood panel, looking at hormones and nutrient markers and inflammatory markers and all kinds of things. And then also a stool test, looking at what's happening in the gut. Is there an infection? Are there overgrowths of bacteria? Are there missing beneficial bacteria? And then I also do a urine test, which just tells us more about the gut and more about your ability to detox. But that's where we start. Cast a fairly big net, find the imbalances, and start to then see where we need to intervene.
That sounds wonderful. I want to go do this right away.
It's always
Now,
fascinating to look under the hood, as I say.
yes, I think that would be. I want to do this. Well, what are some things that people could do today if they're like, okay, I think I'm not doing the right things and I need to get on track to live to be 100. And also help my anxiety. And how can they do that?
Yeah, first thing is to just pick one baby step. I really feel strongly about this because if you look at all the things that might make a difference, it can feel overwhelming. And you don't need to do them all at once. In fact, that would be a mistake because you would last a day or two and then you'd fall back into patterns. Pick one little thing, but whatever seems like the easiest thing. Maybe it's to stop drinking soda and drink like a sparkling water instead, maybe a flavored one. Or, some shift that's going to be healthier, one thing at a time, and make that an easy, like wait till that's pretty natural and easy in a habit, and then pick the next thing. Maybe it's like, I'm going to make sure that I get movement today. I'm going to take a walk every day when I haven't been getting exercise, or I'm going to do something, relaxing for my body, like stretching. But it's one piece at a time and building from there, and then it starts to really add up. So that's where the strategy, right?
Mhm.
So there's food changes, which we've talked a fair amount about. And then there's also supplementation that can be very, very
Mm.
helpful, that is safe to do generally on one's own. Um, and so I can talk more about that if you'd like, which ones are kind of the
Sure.
most
Well, I know
fundamental.
you mentioned omega-3, and I know, well,
Mhm.
one time I just looked up what should someone my age, supplement with? Like, what are the things that I might be missing in my body at this age? And so it just gave a list. And so then I just bought those things and I was taking them. Now, I don't know if that was the right way to do it, but omega-3, I use krill oil. And I don't know if that's the right thing to do, but I would guess that people could just find some things that maybe it would be important for them to take, or you have some recommendations of what those things
Yeah.
are.
Yeah, so let's start with the omega-3s. So they are such a wonderful anti-inflammatory. And the reason we supplement with them is because most people just are not eating them. Um, the primary source for this is certain fish, like wild-caught salmon or sardines or mackerel, which nobody eats. So it's like
Yeah.
not something that most people are thinking about. And you
Hmm.
want to be eating it like multiple times a week to get enough omega-3s. Now, there are certain seeds and like chia, that will have a type of omega-3 in them, but they don't have the type that we need, and we have to convert it. And the problem is that you only convert like 2 to 3% of that. So it's not a great source of that. They're good for other reasons, but I
Hmm.
would not rely on that at all. So if you're not eating the fish, then supplementing is the way to go. And then you've really got to look for one that has a high amount of actual omega-3 in it. If you go buy fish oil, a lot of cheaper fish oils will barely have in it what you need. So you're looking for EPA and DHA. Those are the two omega-3s that you really need. And you want a good quantity, like 1 or 2 grams a day. So these are usually big soft gels, and you can get them at all kinds of markets or online at a supplement provider. And that's a great place to start. The next nutrient I think that is good for your audience in particular, but really most people are low in, is magnesium.
Mm.
And I say your audience because magnesium, especially in the form of magnesium glycinate, that's glycinate, because there's a lot of forms of magnesium. That
Hmm.
magnesium glycinate is extremely relaxing, and it's an
Mm.
anxiety supplement. Magnesium does that, and the glycine it's connected to. They're both helpful for anxiety. And it's a wonderful thing to take at bedtime because it helps with the quality of the sleep as well.
Mm.
But you need magnesium for over 300 reactions in your body, and most people don't get enough. It's been more depleted from the soil, so it's not in our foods as much. That can be a game changer for some folks. So that's the next thing I would recommend. And then
Okay.
the third area I think that's also very important to make sure you're getting enough of if you're struggling with anxiety or depression is B vitamins.
Mm.
That's a long list. B vitamins, there's a lot of them. Um,
Mhm.
and most of them are actually found in animal products like B12 and B6 and these others. But folate is also a B vitamin, and that's in dark leafy greens. So you need to have a well-rounded diet to be getting all of these. And you can supplement with a B complex or a multivitamin that contains a B complex, and that can make a great difference. One little word of caution in particular, because of your audience and your focus on helping people with anxiety. There's a form of B12 that in a few people will trigger anxiety, and
Mm.
that's called methylcobalamin. So cobalamin is B12. And that's the active form in the body. But some people, when they take that as a supplement, they get more anxious. It's a small group of people. But if you
Mm,
take a B complex and you feel more anxious, look and see, is that methylcobalamin? And then you just need to get a different kind, like hydroxycobalamin. That works great.
mm,
But yeah, B vitamins are just essential for mood and for anxiety. So that would be the other piece that I think many people are not getting enough of, especially if they've been eating a diet that's not nutrient
mm,
dense,
hmm.
about the
Well,
processed
and
food.
I think that teens, or at least the ones that I talk to, the junk food and eating fast food
Oh,
is just, part of the
it's
fun of whatever they're
Mhm.
doing. And I try to talk to my clients too about how they're eating. And I realize that I remember loving to eat all that stuff and having fun with my friends, but thinking about how if they at least most of the time are eating healthy things, then they can have the pizza night or the go to McDonald's or whatever on a really, just once in a while basis, as long as they're not doing it a lot.
Yes, that's exactly how I think about this. And even not just for teens. I feel
Well,
like,
yeah, everyone.
that it's really what we're doing most of the time that matters the most. And
Mhm.
I have teenage boys, and this is how we do things. It's like what we cook at home, what I send in lunches, like that we can influence and make
Yeah.
healthy. And they, of course, had to hear me talk about this a lot, so they do know a lot about it. But and then of course sometimes it's like I'm going out with my friends for the fried chicken. Okay, have fun. It's not
Yeah.
what it's doing all the time. And that's
Right.
really important that it's the basis, the foundation that you've got. And then I also think when a kid is eating pretty well most of the time, then they're in a position to notice how they feel when they really, go off the rails. Like I
Hmm.
think of my son has had that experience where he'll do something, maybe it's like get together with the cousins for a weekend and it's just
Hmm.
like eating all kinds of things. And then later,
Yes.
my gut does not feel good. And it's like, well, that's
Yes.
interesting, isn't it? Like if you were doing that
Hmm.
all the time, you would just not feel good all the time and not realize there was a connection. So it gives
Right.
you a chance to sort of observe which things are fine to do sometimes, which things you might really want to not do very often, but at least you know the cost, and which things really flare you and you don't want to have. Because that's the other piece of this food puzzle. I mentioned that certain foods are inflammatory for everyone, but there's other foods that may generally be fine, but for certain people are inflammatory or of a
Hmm.
food sensitivity. And so when cut out a lot of these things and then you test them out, you might notice a reaction. And then that's really important information.
Hmm. I one time did some kind of an online food sensitivity thing, like they would send you this kit and you
Mhm.
would, I think it was hair, but I know there's some with spit too. But I think this one I did was like pull out some hair follicles or whatever. I don't know. But the things that it told me I was sensitive to are things I felt like I never had problems with. So then I was like, is this real? Like, I don't know.
Yeah, so there can be a lot of problems with food sensitivity testing. And there are certainly some approaches and some companies that are way more accurate than others, but the ultimate gold standard always is what's called an elimination diet. So you just say, okay, here's the top, six allergens, or like maybe it's simple, like I'm just going to remove sugar, dairy, and gluten, for example. And I say simple because it's not that many things. I don't mean it's necessarily simple to do the first
All
time
right.
when you realize that's in everything. But
Hmm.
you can prepare for an experiment like that. And I always think of it as an experiment, because if you try to think, oh my gosh, for the rest of my life, I'm not going to eat that stuff. Well, that's deprivation that freaks people out. And it's also not necessarily true at all. So
Hmm.
just think, okay, I'm going to try this for a month and see how
Hmm.
I feel. There's lots of great programs for this. A really well-known one is called the Whole 30.
Oh,
There's tons of recipes out there for that, tons of books. So that's an easy thing for people to Google. And that's going to be sort of a whole foods, anti-inflammatory diet, low sugar kind of approach. And, just do it for a month and see how you feel. And then you add
hmm.
things back in carefully so you can understand one at a time. I always say don't just
Mhm.
fall right headfirst into the pizza, because that's the gluten and the dairy and some sugar. Like do one thing and see for a few days and be like, how do I do when I added back bread, for example?
Mhm.
But that's the best way to identify any reactions you're having. That at least
Mm.
ones that you can tell with symptoms. Of course, there can be some silent type reactions, but that's the gold standard.
Okay, well that makes sense, and that seems, cheaper and easier than
It
what I
is.
was trying to
It is.
do, and then getting weird results that I was like, I don't think this even is true. So that's so cool. Well, how would you like people to get a hold of you or tell us how different people can work with you if they were wanting to do more?
Yeah. Yeah. So there's two great ways. If for people who are actually looking and ready for that level of testing, I do work with adults. There are though other functional medicine doctors who will work with kids, but for people who are California residents, they can become patients. However, what I encourage people to do is to download my little free guide on top 10 overlooked causes of anxiety,
Ooh.
depression, and brain fog. It's simple to read and it'll give you a lot of ideas. And that'll get you on our mailing list, and you'll learn about my online program that anyone could do anywhere. Teens are a great candidate to do this with a parent, for example. And it teaches you, goes way more in depth about some things I talked about today. And this is things you can do on your own. It's a DIY course with
Mm.
additional nutrition coaching built in. And that I think is a wonderful way to address these root causes without having to go all the way to testing and that, like I would say that the majority of the people don't need all of that if they address
Mhm.
these basic foundational things. And if you do that and you get a lot of progress, but not all the way, then you can go and look into seeing a practitioner. But I think
Sure.
that's the best place to start. That program is called the Natural Mood Solution. And the people can also find me on Instagram at drtracymccarthy.com. I'm sorry, Dr. Tracy McCarthy. And my website is drtracymccarthy.com. That guide is at that website /top 10, TOP 10.
Okay, I'm going to put all this in the show notes, though. I know whenever
Yeah, I
I'm
know.
listening to a podcast, I'm always like on the run. I'm in my car.
Same.
All
I can
these
never
different
write it down.
places. And so then
Yeah.
I'm like, oh, I'll go to the show notes later and click on that link. So I'm definitely going to have all those links for people to be able to get this guide and be able to see everything that you're doing. Maybe take this course. I'm going to recommend it to all my clients because I do think that a lot of times their
Mhm.
anxiety can be at least better managed or they feel better if they would eat differently and really pay attention to their physical health. That
Yeah.
is part of the process. So I'm so glad that you're with us so that we could find out more about this. And thank you for all the things that you gave us today.
You're so welcome. It was a pleasure to be here. Thank you so much for having me.
Uh-huh.